Our fellowship program at UCSF Fresno offers a solid, comprehensive training in clinical infectious disease, whether it's inpatient general bread and butter infections, infections in the intensive care unit, or severely immunocompromised patients. And in the outpatient setting, whether it's HIV care, coccidioidomycosis, infection prevention, antimicrobial stewardship, microbiology, and clinical research. Fellows graduate from our program feeling confident that they can take any career track that they want to go into, whether it's private practice, clinical education, or academic research.
I really wanted to be a good clinician, and this is a very clinical program. We get a wide variety of case pathology because we're in the valley. There's a lot of agriculture land. There are immigrants that are coming in from other countries like India and Mexico. So we get all the pathology from this patient population, and that's really what drew me to Fresno.
I am an assistant clinical professor of medicine and part of the ID faculty. And I am also a former resident and fellow of UCSF Fresno. It's been truly amazing. I came upon UCSF Fresno from a recommendation by a friend, and I came here and I immediately knew that I wanted to train here because of the people I met, the diversity, the pathology that I have experienced so far through residency, fellowship, and now as an academic faculty. And the overall support that I get from my fellow colleagues and staff. It's an amazing experience so far.
I've been with the UCSF program in Fresno for 45 years. The thing that I've been most impressed with Fresno since I came here is the fact that we see almost every infectious disease that we thought we would read about in books only. But for some reason, we do get to see a very wide variety of infectious disease.
There is so much to learn here at UCSF Fresno. We have a big farm population, and the illnesses they get based on their lifestyle, and also the fact that there's not a lot of access to care for a lot of them. We have a big HIV population. We have a cancer center which exposes us to our cancer patients, and we also see our transplant patients not immediately post-transplant. And the fact that UCSF Fresno is home to a lot of academic specialties and subspecialties makes for a tremendous learning experience. So from the clinical standpoint, our fellows are really guaranteed to have that exposure.
With level trauma centers, we get very complicated surgical cases, like complicated wound infections, post-op infections, and it's very important for us to know how to manage those challenging cases. And we get to see the patient through from when they get admitted for trauma until they have their surgery and up till post-op infections, as well as long-term complications. So we really see the whole spectrum of that surgical case and get to manage it. So I think that is an important part of ID training.
There's a partnership that we have not only with the local hospital program, but also the association with UCSF is very strong and can be magnified for those who are interested in having additional experiences in transplant medicine.
We also rotate at the VA in Fresno, and the population at the VA is very different from the population at community. So we get training to look at the cases that happen at the VA as well.
Throughout their training, fellows have strong mentors that they closely work with. They get to partner with infection prevention team, antimicrobial stewardship pharmacy team. They get to work with public health folks. Oftentimes they engage with media to answer questions that are arising in the community. So in addition to their medical training, they also get trained on engaging with other departments, other community people out there that need their help.
We get to know our fellows very well, and the fellows get to know us and know each one of the faculty's strengths and weaknesses, and usually by the time they finish their 2-year program, they're very well trained, and they are always they always have us available to back them up even after they leave the program.
Fresno actually is very affordable. The housing here is very affordable in California. I was able to buy my home, and I think that was a big perk of being in Fresno. And the cost of living is generally very good. It really gives you the opportunity to save a lot more, especially within California, and you're able to live a good quality of life while being in reach with everything else within the state.
We love Fresno. Fresno is close to a lot of places. You have Yosemite, it's just an hour away if you're into outdoorsy stuff. The Bay Area is close by, LA is just next door. And of course, like I said, the work I do, the people I am with, I'm really passionate about HIV patients, ID at large, but HIV patients, and I get to take care of them all day, every day, and really do what I am passionate about. So far that's keeping me here, and I think I'm going to be here for the long haul.